If you've lost your zest for life and you're not feeling like yourself, you may have a hormone imbalance and need replacement therapy. But all hormones are not created equally. Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen. So we're talking about not all hormones are created equally. What do you mean by that?
Well, recently there was a new study by the U.S. Preventive Medical Task Force that reviewed the old studies, and they just are saying, repeating to women, hormones are bad. Don't take them for menopausal symptoms, making it sound like, okay, these menopausal symptoms are just mere nuisances that you shouldn't worry about. But there really are indications of more chronic things, that heart disease, cancer risk, that should be looked at and should be treated. But they're confusing women because they're saying all hormones are bad.
Right.
It's not true. It's the synthetic drugs that are the copies of our hormones the drug companies have made are having the side effects that increase a woman's risk of breast cancer by 26 or 29%, heart disease by 26%, strokes by 42%. Those are things that you obviously want to avoid and carry significant risk of death.
I see.
So women shouldn't be so confused. Their hormones are important, and a woman knows if she loses her hormones, she starts to get thinning of the skin, thinning of the bones, and the synthetic versus the natural is what we really want to look at. So we got a slide. This bioidentical hormones are just like the body makes, and they are good for you. So we see the synthetics, the 17-beta estradiol and progestin, not to be confused with the natural estradiol, estriol, progesterone.
So that's the difference.
The
you want to make
synthetic
sure
ones,
you're taking bioidentical.
Exactly. The synthetics are known carcinogens. They cause increase in conversion of cells to cancerous cells, and the natural ones actually protect. You got to have just enough. You don't have too much, even of the natural ones also.
Yes.
So estradiol, I've talked about often on this show, is a natural hormone you can get too much of as well. It's mainly due for fertility. After menopause, you need less of it. During pregnancy, a woman's estriol, the healthy protective one, goes way up. Those are ones we want to emphasize.
Yeah,
so
and you always test for progesterone, estrogen.
all three estrogens, estrone, estradiol, and estriol, and testosterone. Those are the key, and DHEA.
Right.
Every woman should be testing those, just like she knows she should do things preventively. That's the best thing she can do to prevent heart disease, cancer in her future.
And you have an example of a patient that you saw that will kind of tell you why it's so important.
Right.
Yeah.
This is Jenny's story. She was 54. She felt like her life was upside down. She didn't recognize herself anymore. She had the hot flashes, night sweats, low sex drive, and moodiness, irritability, low energy, and hair loss, dry skin. She was cold all the time, weight gain. Those last few are signs of low thyroid. So she's got the female hormones going down, and all of a sudden she's losing her hair. She's got this beautiful brown hardwood floor, and she's got hair everywhere. I said, what is that? So we did tests on her. We found out that her estradiol, the bad one, was okay. It's actually kind of on the low end.
Okay.
We want to build that up. The estriol is the good one. It was really low. Progesterone was low, DHEA, testosterone, they're all low. So we need to build up all these hormones. And within a few weeks, no more hot flashes, no more night sweats. She was feeling great. We also treated her thyroid, and her hair stopped falling out. When a woman comes to me and says, my hair is falling out, they're really panicking.
Yeah.
And it really is an important thing. It's not just a mere vanity thing. That's a real important thyroid hormone.
Sure.
Going to affect everything in her life.
What about the way you take them? There's all this discussion, creams and pills. What's the best way?
The most important thing is to get it into the bloodstream. So we use sublingual capsule. That's a powder that you pour underneath the tongue. It goes directly to the bloodstream. It has its effect on the body, and then it's taken out of the system by the liver every day. So it's replenished every day like it should be. So the creams that go on your skin, eventually the skin blocks it or it puts it into the fat cells, and it doesn't get absorbed well. The pellets, they just get too high in the body for a period of time, then they're too low. You can't change them very easily, and they can't use the good one, the estriol. They have to use the bad one, estradiol, to make it last the 3 to 4 months.
Okay.
So we use the safe ones. The body does need them. Every woman needs these hormones, and as they decline and as we age, that's compounded today by all the environmental chemicals that are making that worse.
And if you're feeling like some of the symptoms we showed you earlier, you have a special offer for people so they can get tested.
Go to our website, sign up for our free newsletter. You'll be automatically entered into a drawing for a free hormone test. It'll test all 6 of those main hormones we talked about. You've got to get your hormones tested. You should be feeling great. A woman shouldn't have all these
Don't write
things.
it off to feeling old and say it's just part of the aging process. It doesn't have to be. Thank you, Dr. Hansen. So good to see you. So if you would like more information on Dr. Hansen, of course, just go to drhansen.com, or you can always call the number you see right there on your screen.